Good morning, and thank you for joining us today. My name is Christine Nielsen, and I am the Executive Director for the Canadian Society for Medical Laboratory Science, or CSMLS. CSMLS is the national certifying body and professional association for medical laboratory technologists, or MLTs, and medical laboratory assistants, or MLAs. MLTs conduct sophisticated laboratory tests on blood, body fluids, and body tissue. They also interpret results. These tests provide critical information about your health. Medical laboratory professionals play an extremely vital role in Canada's healthcare system. As a group, our profession is the third largest healthcare profession in Canada. This morning, we are here to highlight important research findings on barriers faced by internationally educated health professionals in fulfilling entry to practice standards in Canada. Funded through the Government of Canada's Foreign Credential Recognition Program, this research assessed the integration of practicing immigrant health professionals in Canada relative to their domestically educated counterparts, bringing together 5 different health professions: medical laboratory science, represented by CSMLS and the College of Medical Laboratory Technologists of Ontario; medical radiation technology, represented by the Canadian Association of Medical Radiation Technologists; physiotherapy, represented by the Canadian Alliance of Physiotherapy Regulators; occupational therapy, represented by the Canadian Association of Occupational Therapists; and pharmacy, represented by the Canadian Pharmacists Association, the Ontario College of Pharmacists, and the University of Toronto's Leslie Downe School of Pharmacy. The integration of internationally educated professionals into the Canadian workforce is a significant challenge for all professions, including medical laboratory technology. As the national certifying body for medical laboratory technologists, CSMLS is committed to ensuring that credentials are assessed fairly and efficiently, while at the same time safeguarding the integrity of the national certification process. I would now like to turn it over to Keith Johnson, Project Manager for this research, to illustrate the key findings.
Thank you, Christine. This is indeed a seminal piece of research. While many initiatives have looked at the barriers facing skilled immigrants in having their credentials assessed, very few have looked at the quality of their integration once licensed and working. The report, entitled Assessing the Workforce Integration of Internationally Educated Health Professionals, highlights qualitative and quantitative research conducted and examines the extent to which internationally educated health professionals, or IEHPs, have become integrated into their respective occupations relative to their Canadian educated, or CEHP, counterparts. Specifically, several research tools were utilized, including focus groups, interviews, and surveys with participants from across Canada. The collective research suggests a number of interesting trends. I would like to take a moment to highlight just a few of these for you. Firstly, there seems to be relative parity between job and career satisfaction expressed by both groups. 87% of both groups indicated overall satisfaction with their current job after becoming licensed and participating in the workforce. Perhaps slightly even more surprising, IEHPs demonstrate a relatively higher level of satisfaction compared to specific aspects of their job or career as compared with their Canadian educated counterparts. Secondly, there is evidence to suggest that on the whole, the skills and abilities of international workers in the 5 health professions examined are being recognized and successfully incorporated into the workplace by Canadian employers. Nearly 7 out of 10 IEHP respondents said their current employer was doing a good or excellent job in this regard. Furthermore, 73% of IEHPs felt that their overseas training was ultimately very useful in the Canadian context. Finally, and perhaps most significantly, the research conducted also points to areas where IEHPs would benefit from additional support or guidance to further facilitate the integration process. In addition to greater opportunities for clinical placements, it was clearly indicated by IEHPs that a number of other supports would help expedite the integration process. The majority of survey respondents were not able to participate in a formal bridging or mentorship program. Instead, they developed their own ad hoc support system to navigate the first few years of their career in Canada. It is therefore certainly not surprising that over 50% of IEHP survey respondents indicated the desire for additional education and training related to areas such as certification and licensing exams, Canadian and provincial laws and regulations, professional communication skills, machine and technology training, and access to peer support networks.
It is evident that the integration of internationally educated health professionals has benefited from recent attention and investment over the past several years. However, it is also clear that there is still room for improvement and advancement. Canada is presently facing a nationwide shortage of medical laboratory technologists. An alarming 42% will be eligible to retire in the next 10 years. This shortage will directly affect patient safety within our laboratories. Without a doubt, IEHPs would benefit from improved access to clinical placements and education. This move will help to ease the future impact of this shortage and ensure that Canada's healthcare system is not compromised. Based on the report's findings, 4 broad categories of action have been highlighted as recommendations. First, develop additional training and support suited to the needs of IEHPs before and after licensure. Second, investigate how to improve the overall access and availability of clinical placements pre-licensure. Third, develop and disseminate information to employers on the business case advantages of hiring IEHPs. And fourth, conduct future research into the reasons why a number of applicants do not complete the assessment program and therefore ultimately fail to become licensed and integrated into their respective professions. The 5 healthcare professions examined as part of this study remain committed to exploring areas of collaborative opportunities for future work. We thank the Government of Canada for their ongoing support, and we look forward to working together to move forward on these core recommendations. Thank you for your time, and we would be happy to answer any questions you may have.